afternoon, everyone. I'm Lisa Silverman. I'm your facilitator for today. Today, we're here to introduce you to URAC's pharmacy accreditation programs. We know some of you are new to URAC. Some of you may be exploring URAC accreditation or certification, but we're here to help answer some of your questions that you have about the URAC accreditation process. We have a great team with us here today. You can see Greg McRae. Greg, can you give a wave there? Greg's your business development executive, and he'll be your first point of contact if you're a new client with URAC. We've got Heather Bonome, who is our director of pharmacy.
Hi there.
And we've got Heidi Davis and Laura Higginbotham, who are actually two of our reviewers. These are the people you meet along the way. That's on our special programs that we have. And then we'll go into our formal Q&A, which is really just going to be a lot of dialogue between our reviewers and hearing how things function.
Well, thank you, Lisa. Good afternoon and welcome. I'm Greg McRae, and if you're new to URAC, I'll be your first point of contact for URAC's pharmacy accreditation programs. I have been with URAC for 3 years and have national responsibility as the business development executive in pharmacy accreditation. During this time, I have noticed that most first-time applicants have many new questions and apprehensions that are the same. And like my grandmother has always said, there are no bad questions. I'm here today to tell you who we are and why we believe in accreditation. As you can see on your screen, URAC is more than 30 years old, having just celebrated our 30th birthday. We are an independent accreditor, and we do not provide consulting services. We believe that you do not need us to tell you what policy or procedure is best for your organization. We provide you support for our client and educational webinars, and a dedicated client relation manager to guide you through the process. We pride ourselves on keeping the accreditation process fair and completely free of bias. Our reviewers, some of whom you will meet during this webinar, are all clinicians themselves who have 20 years of experience in healthcare. The majority of our reviewers have been with URAC for at least 5 years and are experts in our programs and what makes for high quality healthcare. Our clients have consistently told us they value their URAC accreditation for some of the reasons you see on the screen. Not only does URAC accreditation show compliance with industry standards and regulations, but our accreditation also ensures that your program is one of the highest quality. Many of our clients have said that meeting our standards ensures their programs are even better than what is required by the industry or legislation. URAC offers a wide variety of pharmacy accreditations. We are well known for our specialty pharmacy accreditation. In addition to our accreditations, we also offer designations in special areas for organizations like yours to show that you go above and beyond in patient care. URAC's designations are add-ons to either a new or existing accreditation. We are especially proud of our new Rare Disease Center of Excellence and opioid stewardship designation. It is my role to help you figure out which accreditation is right for you. Here's a small sample of some of over 500 plus current pharmacy clients. As you can see, we have a wide variety of independent pharmacists and other organizations. Heather, Heidi, and Laura will be sharing more about the URAC accreditation process in just a few minutes. But you can see here a brief overview of how your accreditation is processed. After you submit your application information, URAC assigned reviewer will start a desktop review of the application, following up with a request for information if necessary, and scheduling a validation review. At this time, all of our validation reviews are being conducted virtually. But once our public health emergency is over, the reviewers will be back on the road performing reviews. Once the validation review is complete, your reviewer will submit your blinded application to URAC's Accreditation Committee for final determination. URAC's Accreditation Committee meets twice a month, and we notify applicants within 2 weeks to 45 days on average. Once the committee decision, has been rendered. Lisa, now I'll turn the floor back over to you.
Thanks, Greg. We know many of you are new with URAC, and we had a lot of the same questions as Greg mentioned all the time. So we want to answer them here today. We've got about 5 or 6 slides with questions on them, and in between, we want your questions in the chat box. As I mentioned, we have our reviewers who are here who are speaking, who will also be responding in the chat box, as well as some other members of our pharmacy team and other teams. They're happy to answer your questions, and if we don't get to your question today, we'll be sure to get back to you within the next few days. We may not be able to answer all questions, but we're going to do our best. Heidi, let's talk about the resources. Going through an accreditation process can be a little bit daunting, a little bit overwhelming. I know when I look at a guide, sometimes I'm like, that's a lot of pages, that's a lot to do. But we pride ourselves, as Greg said, on offering lots of resources. Can you tell us about some of those resources that we offer?
Sure, Lisa. So signing the contract is really the key that unlocks an assortment of resources, many of which will follow you throughout your relationship with URAC, with one being the assignment of a client relations manager. Your client relations manager will provide continuity of contact regardless of where you are in your accreditation process. You'll also receive access to Accreditation, the system where your desktop review takes place and where there's a specific resource area for you as well. And you'll also receive the accreditation guide for your program. The accreditation guide provides valuable information, like interpretive language for each standard and element of performance, and provides examples of what is considered evidence for both the desktop review as well as the validation review phases. The URAC website also offers applicants access to the client portal, as well as a link to pose interpretation questions you may have. The client portal provides applicants a catalog of free webinars to choose from, ranging from detailed information on the review process to tackling frequently asked questions and best practices that URAC reviewers have observed as part of their collective experiences. And speaking of URAC reviewers, we're not only experts on the standards, but we're also URAC staff who work in the standards and the programs and with applicants on a daily basis.
Thanks, Heidi. Heidi, let's talk a little bit more about what all is involved in submitting the application. What does somebody have to do?
Sure. So your contract will indicate the due date for when your application should be submitted. It's generally about 5 months after your contract is signed, and keep in mind that during this period, your client relations manager is available to you, as is the ability to submit any interpretation questions through the client portal.
So, Laura, Greg mentioned the desktop review. I think some people may be familiar with it, but can you tell us a little bit more? What is it and why is it so important?
Thank you, Lisa. I sure will. Really, the desktop review is a period of your accreditation journey where URAC reviewers are assigned to review and score your uploaded documents. So your lead reviewer will become your main point of contact at this point, and they also will schedule an introduction call with you and your team. The reviewers will start evaluating the information you've uploaded and score each standard based on that information. And that is why it's so critical that you provide to your URAC reviewer citations on where within a document we can find evidence of compliance. Because as a reviewer, I speak for myself as well as my other reviewers, we look for those citations, whether it's in a policy, whether it's in a documented process, or even a set of meeting minutes to determine evidence of compliance with those various standards. Also, when we score a standard is not met, we provide information on why it didn't meet the intent and give you guidance on what additional information is necessary to meet the intent of the standard. That could be a revised policy and procedure, it could be a supplemental policy, it could be committee meeting minutes, or it could be even applicable reports. Also, during this phase of the accreditation process, this is your opportunity to ask your reviewers any questions at all related to any of the standards. The best way to pose those questions to your reviewers, however, is via email. What we do is we just ask that you provide us with that standard number so we know what your question, what standard your question is applicable to. And really the goal of the desktop review is not only that you understand what is required to meet this standard, but that you also have documented process to comply with each one of them. So understanding the standard and fine-tuning your processes will help your organization prepare for that validation review.
Thanks, Laura. Brooke, I see your question in there. I'm actually going to ask Heather to get to that kind of when we're right done with this slide. So hang tight, we're going to get there. Laura, let's go and let's talk about validation review. This can be big and scary. I have friends and family members who have said, yep, when that accrediting organization is coming, everything stops for the organization. Tell me a little bit more about that if I'm new to URAC and how we do it here.
We try not to have it in that situation. So really the validation review is conducted by the same reviewers that conducted the desktop review. So you already have a relationship with those folks. An agenda is sent out ahead of time so you know what to expect. You can ask questions regarding the agenda before we actually complete the validation review. Usually the validation review is 1 to 2 days and will consist of additional documentation review, tour the pharmacy once we assume travel again, and we interview key individuals within your organization, such as the pharmacist in charge. And really, the goal of the validation review is to confirm that those day-to-day operations actually reflect your documented processes that you submitted on your desktop review.
Thanks, Laura. I've heard this, one of my joys is talking to clients after they've been accredited. And I've heard from so many of them that they've said, it's not a big deal when URAC staff members come. We know them already. They've gotten to know us. It's really a walkthrough and getting to show where we're successful and getting to show how we do things well and how the accreditation, you hear that they tell us how the accreditation made us better. And we love hearing those stories, and good to know when we're there, it's a learning experience for both of us.
Absolutely.
So Laura, after you've done that validation review, what happens? Where does it go?
Sure. So after we finish the validation review, we summarize those findings, and your application is presented blinded to your accreditation committee. The members of the accreditation committee are volunteers from other accredited organizations. URAC staff facilitates that meeting, but we're non-voting members. It's the accreditation committee that makes those accreditation decisions, and then you're notified frequently within 10 days of the committee's decision.
Awesome. And then Laura, last question for you on this slide. Why does the process take us 6 months? What happens in there?
Sure. Well, really, Lisa and those that are on the phone, the majority of that time is given to submit your application and to work through that desktop review process, because we want to make sure your organization's processes are in compliance to the standards before we actually do complete that validation review.
Thank you. Brooke, I see your question about expectations about a dedicated full-time person. And I think this comes up a lot of how much staff time will I need? How many resources? Heather, I'm going to ask you to go into this a little bit.
Sure, happy to. And Brooke, you're probably going to hate this answer, but it depends, right? And because organizations that come to URAC are all shapes and sizes of pharmacies and different levels of already being prepared. So if you in general already have your policies and procedures documented, you've got a really good process for policy management and review and all of that, and you do a lot of documentation already, it's probably not going to be as heavy of a lift, and you'll just have to do a lot more pointing. Oh, this policy meets this standard, this policy meets this standard. If maybe in the past you haven't documented your processes as much, or documented your policies, or have a process for routine quality management committee meetings, then it might be a heavier lift and you might need to put some more resources to it. So one of the best ways to figure that out is, when you're working through the process, is to take the accreditation standards and like, yep, we already do this, it's documented. Nope, we don't do this, but perform a gap analysis, and that can help you to decide how much you're going to need to do and how many resources you might need to put towards that.
Thanks, Heather. Heather, this next question is actually for you. Somebody says, I've been told by my higher ups that I need to get this done in 4 months. They need it done so we can close out some books on the year, so we can say we accomplished it. What do we say to that person?
So, Laura walked through all of the different steps in the accreditation process, and each one of those steps is really key to the integrity of the review process. So we can't skip any of those steps, but, really there are some opportunities to speed up the process. There's not a formal expedited review process or anything like that, but as was mentioned, you usually have about 5 months after you sign your contract to submit your application. If you have all your ducks in a row and you really want to get this moving, you don't have to wait until your application due date to submit the application. You can submit it earlier, and as soon as you submit it, we assign reviewers, we start working through that process. Similarly, if your policies and procedures are pretty clean and you've given us really clear citations as to exactly what to look for, the desktop review process can be smoother as well, and that can help to speed up the process too.
Thanks, Heather. But then there's the other side of that, and especially during COVID, when pharmacies are tapped so thin, but we know they want to go through the process. What if they need more time?
Yeah, look, we understand that there are circumstances that arise that might require an extension in the review process or in time to submit your application. We do have an extension process that is available for a fee if you need some more time to submit your application, and your client relations manager is your point of contact for that.
Awesome. Thanks, Heather. Heidi, let's talk about accreditation consultants. I actually didn't see anybody who answered the poll saying they were an accreditation consultant, but what do you say if somebody asked you, should I work with an accreditation consultant?
Yeah, so, URAC really doesn't recommend one way or the other. We've seen organizations that work with accreditation consultants that are successful, but also organizations that choose to do it themselves and achieve success. So really, as a reviewer, I'm looking to confirm that you're complying with the standards. And, if you're going to work with a consultant, make sure that the policies are your own. Don't rely on them to provide information to you without doing your due diligence rather, to get in there and make those policies your own. Make sure that you're working in those policies day in and day out. So that's, again, it can work either way for organizations. It's really kind of your preference. What I would just like to say is that the question that you asked me earlier, I realized that I did not answer correctly. I got a little nervous and skipped some notes that I had. So I just, if anyone listened to my answer and they're like, what was she saying? It's because I read the wrong information. So if we'd like to revisit that, I'd be more than happy to. Because I know as I was answering it, I was like, what am I saying? That's not right.
We chalk this up to we're all human. I don't think 15 months ago any of us expected to be doing webinars out of our houses on a regular basis. So all is forgiven, and we will get clarifying information in here. We love seeing the questions come through, so feel free to keep adding to them, because you heard we will stop and we will pause. Okay, so here's a really one that I love. And we saw 50% of our attendees here are in a hospital. So your hospital very well may offer a specialty pharmacy. They may offer a mail service pharmacy. They may offer remote patient monitoring. They may offer health utilization management. They may offer, my favorite one is call center and contact center, right? So can I go through multiple accreditations at the same time? If I say, hey, I've got these teams and it's really great to be on the same page and on the same cycle, what do we say?
Yeah, absolutely. In fact, grouping them together when you've got multiple programs that you're going to seek accreditation under, if you're doing them at the same time, it's a great idea. The standards across many of the programs will be met with the same policies in a lot of cases. So if you're ready to submit an application for 2 or even more programs at the same time, ask about that possibility. We'll certainly be happy to work with you.
And that's where Greg comes back, and Greg can work with his team. He can work with, we've got Jeff Carr, who is our Vice President for Business Development on here. He's happy to connect with you either here or LinkedIn. Talk about what does that look like if you want to combine. And you can, we can add designations too, but designations can be added anywhere along the process. So Laura, okay, this gets a little trickier. If you're applying for URAC, can you use documentation that you use for another organization? We know many of our clients are accredited by multiple organizations. What happens there? What can they use to prove?
Absolutely, Lisa. You can use the same documents you used for URAC accreditation versus another one. But URAC, we don't expect you to have URAC specific policies and procedures. However, what you will want to make sure your organization does is review the URAC standards against the policies and procedures that you have in place for the other accrediting organization to ensure they're in compliance to the URAC standards. While accrediting organization standards could be similar, there could be some that are more stringent than others. So again, just to make sure you review those policies, make sure they're in compliance to the standards.
Thanks, Laura. Heather, this next set of questions is going to come through you. You're going to finish out this slide and do the next one. But in between, Michael's asking us a question for the difference between specialty and infusion pharmacy. And Michael, we will send you the links to where both of those are on our page. But Heather, I'm hoping you can answer if somebody has both specialty and infusion.
Sure. In fact, we work with a lot of pharmacies that have both a specialty pharmacy practice as well as a home infusion practice or just infusion practice. So specialty pharmacy, think of that and think of it as your practice of the traditional specialty pharmacy categories. So that might be your Hep C, your MS, your RA, HIV. That sounded like a lot of letters that I just said. But you know, your more typical specialty medications that you're often filling in and require additional patient care services, but are not actually infused medications. And then our infusion therapy program is actually a newer program, and it was developed specifically to meet CMS standards, and it is a CMS deemed program for providing home infusion therapy services. So it is specific to the infused medication, and again, it's aligned with CMS requirements and provides accreditation from a deemed organization.
Great question. We love having those questions come in. Heather, this is the question on everybody's minds. The bottom of the slide you see on your screen. What percentage of pharmacies achieve accreditation the first time through?
Got it. So the good news is a great majority of organizations do achieve accreditation their first time through. And it's, again, because of the process that Heidi and Laura spoke to, where we spend a lot of time with organizations on the desktop review, making sure that you have policies and procedures in place to be successful. But in preparation for today, I did take a look at our 2020 numbers in the pharmacy space and found that more than 97% of the first-time pharmacy applicants achieved an accredited status. Again, this is because we provide so many tools to help pharmacies in the review process, like webinars and accreditation guides and the interpretation portal. And then again, of course, that critical desktop review process where you're working and getting feedback directly from our reviewers.
Thanks, Heather. Notice of change comes up a lot. Pharmacies move, businesses grow. I'm gonna just have you run through this slide here. They are your questions to go for, and people change. So let's start there. You've got what happens if I move to a new location?
Sure. So if you're in the accreditation review process and your pharmacy moves from one location to another, and this happens all the time, you know, we have a process for that, and it's called cleverly, the notice of change process. And it just tracks and evaluates any kind of change like that. So when you're planning a move, you want to let your client relations manager or your reviewer know, and they can walk you through that process. So, and there are a couple of different flavors on this slide, right? If I'm in the accreditation review process, can I move? Yes, you can. Submit the notice of change. It will help you figure that out. What if you move to a new location after you're accredited? Again, pharmacies are changing, you're growing, you need a bigger space because you're getting all these new patients, which is fantastic. So if you move or add a new location, same thing. It's the notice of change process that lets us track and evaluate that. We might ask some questions about how a move impacts your operations if you're already accredited, just so we can see if there's any impact to your accreditation. But again, we have this process in place because it happens and we know we need to be able to handle and address them. If you add a new location after you're accredited, again, submit a notice of change to us to report your new location. There is a fee required to add a new site to your accreditation, and a URAC reviewer will conduct a supplemental review that just focuses on that location. We don't do the whole desktop review again. That's done. We know how you do what you do. We just need to make sure that that new location is also compliant with the standards. Another one that again happens a lot in the pharmacy space, there's a lot of mergers and acquisitions happening. So what does URAC accreditation transfer if the pharmacy changes ownership? So URAC accreditation is not automatically transferable, and you'll see that stated in your contract. So again, anytime a material change, submit the notice of change, and URAC will review the details of that change, will consider what, if any, impact there is to compliance with the standards. The follow-up will likely require a contract amendment to recognize the new ownership, perhaps a for-cause review to confirm that the pharmacy remains compliant with the standards. Again, this is not an infrequent occurrence. That's why we have a process to address it and to figure out how it might impact your accreditation. Did I get them all, Lisa?
I think you did. And we've got the main point of contact, right? We're clear on that. We know people change.
Main point of contact. This happens frequently as well. It's really important, though, that you keep us up to date with your main point of contact. That is the person that's going to get all the notifications from URAC. That's who your reviewer is going to reach out to. That's who's going to get a letter from me after you achieve accreditation. So really important that the right person is linked to us. Now, more than one person can have access to our system and more than one person can help to work through the process. That is no issue. We just need to have that one key point of contact so we know who to send the good information to.
Heather, one of the things I've heard along the way so many times is that the best successful accreditations are done by full teams, and people have said, they've said on webinars like this, our clients have said to us, it takes a whole team to get it done. It can't just be a one-person project. And I think we're really proud that our CreditNet application system does allow for multiple people to be in there submitting documents. One person, the point of contact, has to be the one to submit the final application. But if you've got somebody who can submit some HR documents, somebody else who can submit some safety documents, they can all have access in that system. And they can actually all have access to our training webinars as well.
Sure. Yep.
Heather, we have this really interesting question that came in, and I think this is going to be a judgment call for the organization. But when do you suggest a new pharmacy begin the accreditation process? Is it before board certification, after they've become operations? I know it's a little bit different.
Yeah, you know what, it's going to be different for every organization and what works for you. And we recognize that we have to have some flexibility in our process too, which is why we have that extension process. So say you do sign up and your board of pharmacy review ends up being pushed a month or two for COVID or whatever reason, and you need some additional time. You can let us know that. We can evaluate how that impacts your timeline and the standards. So if you've already started the process, we do need to keep you moving through the process. We can't just stop and, whatever. But we have processes for that to understand that these things happen. Another thing that happens frequently is, we're building out our new pharmacy and we've signed up for accreditation, and oops, the contractors are taking longer, and then oops, that bumped our Board of Pharmacy inspection and oops, and so things like that. And again, this can't go on and on and on, but understanding that life happens and circumstances arise when we need to work with folks on that, that works. Also, just one other just brief point, and I won't labor on this too long, but if you have signed up and you are slower in going through the accreditation process, you can even submit your application. We can review your policies and procedures, but if you haven't launched your practice yet, maybe you don't have clients yet, there is the availability or the potential, I guess is a better way to say it, the potential to earn a provisional status. And that means you've got everything in place. We've reviewed through the desktop review, your policies, your procedures, you have the infrastructure. You just don't have patience yet. And then, so that can be considered as an option. And then once you get patients, you let us know and we conduct the validation review. So again, there are ways to address a lot of different circumstances.
Heather, I think one of the things that makes URAC shine is that extreme amount within reason, a flexibility of, as Greg mentioned, we're not telling you, and Heidi actually explained this to me a couple weeks ago, we're not telling you what documentation you have to submit. You have to prove that you can meet the standard, but we're not saying that every organization has to submit this same policies and procedures document. We're saying you submit to us what works for your organization. That flexibility here in this, when do I get started? When do I do it? I think that's one of the great things about a URAC accreditation is that we're looking at you not as a series of checkboxes, but really just to say, what is your organization doing? What's helping to improve, innovate, make healthcare better for patients all across the country? And we're international with some of our remote and digital health programs at this point. So I think that's one of the great things.
It's a great point, Lisa, because we accredit very large organizations with multiple sites. We accredit very small organizations with a handful of employees. And your compliance officer might be the chair of your quality committee and your pharmacist in charge. And that's okay. We've absolutely accredited organizations. So we have to hold everybody to the standards. Otherwise, the program doesn't have that level of rigor. But understanding that there are many different ways that the standards can be met and that we need to allow for that.
Yeah, I think that's my favorite part here. And Laura just put up the, so Laura Wood reminded us that lots of organizations have specialty pharmacy and mail service pharmacy accreditations. And Laura, will you even chat in a link to the directory so people can see what it looks like, just if they want to scroll through and see who's there? Because that's actually, as we go on to the after accreditation part, we'll get into that. And Laura Higginbotham, you point out in the chat box here, you're looking at, does the documentation meet the intent of the standard? When you are a client, you'll receive that guide, and it's really showing you what we're looking for. We're looking for you to show us somewhere here in your policies, and then in the validation review, can you speak to what that intent means? And Laura and Heidi, if you want to come up with an example, I can't think of an example because I don't know a standard off the top of my head real quick, but if there's something we can say that's simple that does this meet it, let's get that chatted in there. And Laura Wood chatted in the directory here. We've got a question here, and we have a question about why URAC versus ACHC. Heather, I'm looking at you again.
I'll take it, sure.
Awesome.
Yeah, and so here's the thing. We're not going to speak to another accrediting organization. We recognize that there are other accrediting organizations out there that have programs such as specialty pharmacy. I think what we'll highlight, and we spent a lot of time at the beginning of this program talking about the accreditation process, the desktop review process, the interaction with the reviewers. That is unique to URAC. And, we're really proud of our process and how we do things. So that's something that is different, and not all accreditors conduct the review process the same way. And I believe that is why URAC is recognized as the gold standard in accreditation. We have very rigorous standards. We have a rigorous process, but a comprehensive process and an educational process that helps that results in a program that has been recognized by third parties as the gold standard. So this is why a lot of payers, a lot of manufacturers, to participate in their networks, they've recognized URAC as the gold standard in accreditation, and being able to meet those standards means something.
Heather, kudos to your team. I had the pleasure of working with Heather on a different Heather on your review team on creating these wonderful webinars that are available only to clients. If you are a current client, if you're not a current client, check with me or ask your client relations manager or your business development exec about access to those if you're interested for a small fee. But those webinars are great. It was wonderful to work with your team and say, here's what we're willing to share you. We're going to talk to you about all of these different areas here and make sure that you understand them clearly. And they're recorded webinars that as a client, you can go back to as many times as you need to. If you just have a quick something you want to look at, it's right there. We love the after accreditation part. It's so good to see clients go through it. Heather, what's the best way for an organization to leverage accreditation?
So yes, achieving accreditation with, again, the gold standard in pharmacy accreditation is quite an accomplishment, and one we hope that the folks will celebrate once achieved. I like to think of it this way, like compliance with the URAC standards, it provides you with the tools to operate as a quality organization. You're going to be tracking your performance metrics and clinical outcomes. Those are standards that you need to be, so you need to be doing this, but this can help you to market your services. Like, don't track your outcomes and your successes just to comply with URAC standards. Do it to optimize patient care, to quantify that success, and then share your ability to demonstrate the quality of your services. I think that's the best way to be able to highlight and leverage all that work that you did during the accreditation process.
Absolutely. We know people want to do the pharmacy accreditation sometimes because it helps them get the network contacts. What's URAC's role in that?
So let's take a step back and remember that URAC is an independent accreditation organization. And our mission is to advance the quality of healthcare by administering the accreditation process. So we're not a network and we're not a membership organization that's going to promote pharmacies or facilitate contracts. And in fact, participating in those activities could interfere with our independent status. So that's pretty important. But of course, and as we mentioned a few times already, we know that many payers require accreditation for network participation. So we encourage pharmacies to research network requirements before pursuing accreditation, so you know what to expect once you achieve accreditation. And often if a pharmacy is not successful in gaining access to a national network after they've achieved accreditation, they might find success in partnering with a local or a regional plan. We see this pretty often. Healthcare is local. So again, take those competencies that you've gained by achieving accreditation and the ability to track your successes and find partners to work with. And we've seen a lot of success with folks that way.
Heather, we have this other question come in. Do you go to the PBMs to market our program?
That is not something that we have actively done. Again, the payers, manufacturers and such, they independently recognize our programs as the gold standard in accreditation.
Laura, this question goes to you. It's actually one of the simple ones. How long does the accreditation last, and what's the reaccreditation process? Maybe the second part isn't quite so simple.
It's okay. The accreditation's for 3 years, and the reaccreditation process is very similar to what we explained earlier for an initial accreditation. Really, the key is more the difference between what URAC terms as the look back period. So where for an initial accreditation, we would look back from just the time you submitted your initial documents or your initial application. But for reaccreditation, Lisa, we look back a whole 3 years. But also to note too, for reaccreditation, there could be changes or revisions of the standards that an organization needs to make sure that their policies, procedures, et cetera, are in compliance to those new revisions. In the case that there are changes, that index date could be adjusted accordingly. So,
Thanks, Laura.
So basically, in summary, it's almost the same.
And I've actually heard from clients in another program who have said, you know, the URAC process actually forces us to update our programs even more regularly and forces us to update our policies and procedures. So if we're encouraging you to do that along the way, then come that 3 years, hopefully it's not a big deal. Hopefully you've been doing it those in between years and you have it ready to go. You know, I do have to wonder, do you hear, Laura and Heidi and Heather, do you hear from repeat clients, from reaccreds, that it's so much easier the second time?
I can take that one. Usually it's harder. And the reason being is that you have much more of a longer look back period to show evidence of compliance versus an initial one where you're looking for reaccreditation, you're looking 3 years. For initial, it could be as little as 3 months. So it's harder on a reaccreditation because you have to maintain it that whole 3 years.
But still absolutely valuable, because we hear that from our clients. Heidi, this goes to you. This next question here, the value in accreditation.
Yeah, so, you know, when it comes to some of the feedback that we get, I think that we've spent a lot of time today kind of talking about, you know, accreditation. Seeking accreditation is a lot of work. Lisa, you talked about kind of like that whole team effort that can be required. And we also talked a lot about, you know, the different activities that are involved. But ultimately, working through all of that really works to help strengthen the organizations. And they recognize that. And they know that going through the accreditation process ultimately results in a program that they're proud of. They're proud of the work that they've done. They're proud of what they've achieved. And when a client says that seeking URAC accreditation has made them better, they not only have the experience, but they also have the data to demonstrate that, both to themselves and to the communities that they serve.
We have space for more questions in here, but I'm actually going to ask Heidi, Laura, and Heather a softball question on this here. I want to know your experience being out in the field, working directly with our clients. What's the best part when you see what's the best part of seeing a client go through the accreditation process? Laura, I see you're nodding, so I'm going to ask you to start there.
Well, when we started, Lisa, you had, I think it was before my question, when you were talking about how people are stressed, worried about, you know, us walking in, and you see their shoulders all the way up here. But I think by the end of the day, it goes down and they're relaxed. And when you finally sit there and say, you know, we found no deficiencies, it's like, oh my goodness, we're done, we were successful. And I've seen tears. I think it's just a relief that they were successful in their efforts. And it makes me feel good for them because I personally know the work that is involved to get to where they are today. It is a lot of work. And I say go celebrate once you finish. So that's my 2 cents.
Laura, you mentioned something that I love. I love that before the reviewers leave your site, whether it's virtual or in this case it's virtual, because we're still home and it's on site, they actually have heard from you. Like you have debriefed with them and you spent some time at the end of those 2 days telling them. I think that's a nice peace of mind. It's not just like we're URAC, we're going to walk out the door and you don't know where you stand, so you're going to sit here until the decision, which comes quickly. But I love that personal connection that we're able to make at the end.
I always share, Lisa, I give them opportunities for improvement if there were things that were identified. But remember, we don't make the discreditation decision, it's the accreditation committee. But we give them some sort of idea, but I don't always say they're deficiencies. I present it as opportunities for them to improve.
Awesome. Heidi, you finished that review, you've worked with the client, and maybe it's after you hear back, after the client actually knows the formal decision. What's the moment there?
I think in those moments and in those instances, um, I feel like there's definitely a sense of pride from the organization, and there's a bit of pride for me too, because I want to see these organizations succeed. I've been through accreditations myself for many years, working as a home infusion pharmacist, and I know the amount of work that goes into it, and I know that getting that accreditation, there's that moment of relief, but then Laura kind of alluded to it, is that's the work continues, and it's just going through that process, them having the strength and the confidence to know that they have a solid foundation now to work on for the next couple of years before they seek reaccreditation.
I love that the pride in the work, and I've heard that from our accredited clients who get really happy, and we know it's a huge deal. Heather, I'm going to field this question from Chara over to you. How are we addressing the costs for physician dispensaries?
So we did recently launch a program called the Specialty Physician Practice Dispensing Program. It's a little bit of a mouthful, but I think I got all those words right. And what it is doing, it came to us as a request from several organizations with physician dispensaries dispensing specialty medications that wanted to be able to demonstrate that they were dispensing in a manner that meets the same quality standards that our specialty pharmacy accreditation meets. But our specialty pharmacy accreditation, you have to be a pharmacy because it's a specialty pharmacy program. So we reviewed the standards. The programs are very similar, recognizing that the whole point is validating the quality of that services being provided. But we did make some tweaks to make it fit for a physician dispensary. So that program is available now. And then Greg is the point of contact that can work with you on what that cost looks like, and can work with you. If you're concerned about that, that's something that he can work through with you, and we can handle that for you.
And I know Jeff had chatted in Greg's information a little while ago. I also want to give a plug. Nick had chatted in our social media channels. He chatted in our YouTube page and our LinkedIn page. So if you're not following us on LinkedIn yet, we hope you'll do so. That's a great way to both see organizations that are being accredited, and you'll be able to see just some other articles of interest that we post, what's happening. We're constantly finding articles that we think may be of interest to our followers and our clients. So we have those there. We'll give another, I don't see any more questions coming in. We're about nearing the end of our time. Heather, I'm going to ask you to close us out. Like your colleague said, best part of this, best part of seeing clients. Close it out for us, please.
I mean, for me, I love what we get to do, because we get to see pharmacies innovating, coming up with new ideas, new ways to do things. And we get to see all of that, which is just phenomenal. I love hearing from the reviewers. I love getting to participate in the reviews, and just getting to see all the really exciting things that are happening in pharmacy. And what that lets us do is, take that back, share those as best practices when appropriate, incorporate them into new standards when it's appropriate, and really elevate the level of care that patients in this country are getting. It's really meaningful work to us, and I hope that comes through as folks are working with us through the accreditation process.
Greg, Heather, Laura, Heidi, thank you so much for joining us. If you have questions, you can always submit them through our website, or you can reply to education@urac.org. I checked that inbox. We love your questions. If we didn't get to answer something today, we're going to get back to you about it one-on-one. But again, please check us out on LinkedIn, on YouTube. Thank you all. Whether you're with the hospital, the Health Systems Association, you all are diving in extra long and hard these days due to COVID, and we could not be doing this work without you. We are so appreciative of our clients and all they're bringing. So thank you from URAC. And this officially concludes our webinar.